Are your eyes dry, irritated, watery, especially in the morning, and you've tried eye drops and other treatments and nothing really seems to work? This may be the answer that you're looking for. Let's focus in. Now, a good portion of people that have these symptoms, it can come from many different things. Blepharitis, dirty eyelids, Demodex, recurrent corneal erosions, or lagophthalmos, where the eyelids don't close all of the way in the middle of the night. Now, likely, most people that have these symptoms actually comes from an inadequate eyelid seal. So similar how lagophthalmos doesn't close all the way, the eyelids don't properly seal together. You can think of the eyelids kind of like teeth. Teeth have a proper alignment when they close. Eyelids have a proper alignment as well. They should close right on top of each other, sealing off the eye. Now, a lot of people, without even realizing it, might have an overbite. Kind of like teeth might have an overbite, the eyelids might have an overbite, leaving a little bit of a gap there that leaves the eye exposed. Now, as doctors, sometimes we'll see signs of this on the surface of the eye. So we'll ask the patient, hey, do you sleep with your eyes open? Or has anybody ever told you that you sleep with your eyes open? And unless it's obvious, unless it's lagophthalmos, the eyelid is not closing at night, then a lot of times they don't even know, or nobody's ever told them that. Because if it is just the inadequate eyelid seal, it looks like their eyes are closed. They just have that overbite that's causing that gap and drying their eyes out. Now, if you have this, you likely have had this for a while. Eventually, the eye gets to a point where it just can't fight the inflammation anymore. It can't fight the dryness anymore. The inflammation gets so much that it's just too much of a battle, and so then the eye symptoms start coming in. The watering starts getting worse. And that's also why some eye drops or eye treatments stop working or don't really work that well, is every night when you go to bed, you have that gap, flares up the dryness and the inflammation, and then throughout the day, you're trying to use the eye drops and dry eye treatments to backtrack a little bit, and it just becomes too much. It's not enough to fight the inflammation. Now, a good test that doctors can do to see if someone might have inadequate eyelid seal is called the Korb-Blackie lid light test. You have the patient kind of lean back, close their eyes like they're going to go to sleep, and we'll put a light right on the top of the eyelid and see if any light escapes between the top and bottom eyelid. If there's light that's coming out there, there's a good chance you have a gap there. So if you have this, what can you actually do about it? And this leads me to the answer that I was talking about. It's a new device or a new product called Tite Sleep Rite. Now, this video is not sponsored. This is actually a fairly new device or a fairly new product, but so far has been having a lot of great success. So let's go over exactly what it is and how you actually use it. Now, before we keep going, if you have any tips that have helped you, definitely leave it in the comments below. More than likely, your tips will actually help people out more than you will know. So it's actually an eyelid seal designed to actually keep your eyes closed at night. And it's latex-free, hypoallergenic, porous, so it actually breathes at night or breathes on the skin. And it's kind of like eyelid tape, so it's really safe for the skin. It won't hurt to pull it off. It won't take off your eyelashes or anything like that. Now, these are designed to actually put on at nighttime right before you go to bed. And usually it's recommended just to be put on one eye, at least starting out for about 4 to 6 weeks. And then when you get more comfortable with it, you can start wearing them on both eyes. But just remember, if you have to get up in the middle of the night to go to the bathroom, you'll probably have to take one off so you can actually see to go to the bathroom. So when you put it on, you're going to close your eye in your eyelid, and you're going to put it on right like that. And you're going to make sure that it's sealed right on the bottom of your eyelid and on the top eyelid. And it has a little tab on the side, so when you actually go take it off in the morning, it's really easy to take off. But yeah, you're going to want to rub your fingers around the edges just to make sure that's properly sealed. And also, right before you go to bed, make sure that you check to see if any light is coming through the eyelids. If you see some light, then it's not properly sealed and you'll probably want to reapply it. So yeah, this is designed to be worn all night, but if you do have to get up and actually take it off, you can actually put it back on the white slip here, and then when you go back to bed, you can put it back on there. But it's designed just to be used one time, so after that night, you're going to take it off and throw it away when you get up in the morning. And it actually is quite comfortable. I've been wearing them for a few nights, and it actually goes pretty well. In fact, the eye that I usually tape, my actually feels pretty good in the morning. So I bet I have some type of a gap there and causing some of my symptoms. So yeah, then when you get up in the morning, you can just take that tab that's already made for you and slowly peel away. And it's usually recommended to kind of peel at an angle downward, so you're not kind of lifting your top eyelid up. but that just makes it easier to kind of take off. Really easy, doesn't really hurt, doesn't take off your eyelashes or anything like that. No, it is tape, so you're kind of taking tape off, but it's actually not that bad. So really easy to use. Now, right before you put them on, you do want to clean your eyelids and your eyelashes, either using eyelid wipes or cleansing foams. I have some videos about that. I'll put the links in the description below. You want to remove all the makeup, so it's just taping the eyelids, the tissue. You don't have anything getting in the way. So this is pretty much helping the eyelids do what they were designed to do. Getting a great eyelid seal at night, helping the eyes recover from the day, decreasing the inflammation. And actually, they're getting a lot of reports from people that say that they're getting a better night's rest, a better night's sleep when they actually use these. And if you think about it, you don't have a stimulus throughout the night, a dry eye or inflamed, irritated eye that might be keeping you from getting a good night's rest. And so this might actually help you sleep better. Sleep tight, sleep right. Now, like I said, starting off, you'll start with the one eye, the worst eye, wear it for about 4 to 6 weeks, help it recover from that inflammation. And then when you're feeling more comfortable, you can start wearing it on both eyes or alternating the eye one night, the other eye the other night. And this is over the counter, meaning you don't need a prescription. Right now, you can get it online for about $40. There is $5 shipping, so it's about $45 for 30 strips. And if you're just doing the one eye for right now, that'll last you for about 2 months, so it's actually not that bad. And I'll put a link in the description below so you can actually check that out if you want to order some of these. But you'll probably also start finding them in doctors' offices around if they provide that. Now, this just may seem simple. I mean, you really are just taping your eyelids shut, but that might be exactly what you need. That might be exactly what the problem is. And this is designed to give you the optimal results to fix the problem. And so if you have these symptoms, if you have this problem, this may be worth to pick up. Now, even though this is over the counter, I still recommend that you actually use this in conjunction working with your eye doctor. It's nice to have a baseline to know where your eyes are before you start using this, and then maybe doing a follow-up in 4 to 6 weeks just to see if it's actually helping or if the signs or the symptoms are reducing. So yeah, definitely work with your eye doctor on this. I think you'll have better results. Now, if you're looking for specific tips for eyes watering in the morning, I actually did a whole video about that you can check out right here, or you can check out my playlist about dry eyes right here. I'm Dr. Neil Gaiman, Dr. Eye Guy. Stay focused.